Greetings, everyone, and welcome to today's special webinar on the 2021 Lancet Countdown Report and the Policy Brief for Canada. My name is Ian Culbert. I am the Executive Director of the Canadian Public Health Association, and I'm happy to be the host for this afternoon's webinar. I want to begin by acknowledging that CPHA's offices and my home from where I'm participating today is located on the ancestral and unceded territory of the Algonquin and Anishinaabe peoples. CPHA recognizes that truth and reconciliation is an ongoing and evolving process that every interaction between First Nations, Inuit and Métis peoples and non-Indigenous peoples is an opportunity to advance truth and reconciliation. As part of that process, CPHA has established an Indigenous Advisory Council to provide advice on CPHA's policy development, our programs, and our other activities. It is very much my pleasure to be hosting today. CPHA has a long-standing history and commitment to discussions about the ecological determinants of health, human and ecosystem health, and climate change, as noted by some of the position statements that are on your screen right now. Most notably, the 1992 report, Human and Ecosystem Health, in the introduction, spoke of climate change in the following terms. It is the greatest challenge public health has ever faced, and one that we have come to late, but not too late, we hope. There is still time for us to do what we have to do, to join with the environmental movement, with government and business, and with our friends and colleagues, our neighbors and families. Only by becoming part of the growing global movement to protect and enhance human and ecosystem health can we hope to ensure that generations to come will also be able to see the Earth as we see it, a beautiful living planet, and to be moved by that sight. So 1992, almost 30 years ago, but those words ring true still today. CPHA has also been very pleased to collaborate with the Lancet Countdown to issue 4, now 5 policy briefs in collaboration over the last few years with the Canadian Medical Association. So we're continuing that tradition today, and welcome all of you to this webinar to learn more about what is in this year's policy brief. Now, unfortunately, this webinar is scheduled at exactly the same time as the Canadian Medical Association's Board of Directors meeting. So unfortunately, Dr. Catherine Smart, president of the CMA, is unable to join us. However, she did send along a video message that we'll play now.
The audio doesn't seem to be working, Ian. Maybe we can restart the video, get the audio.
Okay, my apologies for that. I do not know how, the audio was fine in my here, so I do not know how to fix it. So we will work on that in the background and hopefully be able to bring that video back to everyone later in today's session. And my apologies to CMA for that technical glitch. However, let us move on, and it is, very much my pleasure. Now we need to move beyond, sorry. And I'll just provide a quick overview of the session today. And technology, always lovely. So first, we are going to hear the findings of the Lancet Countdown International Report from Dr. Ian Hamilton. Then we'll have an overview of the Canadian brief, some comments from Dr. Deborah McGregor, and then some concluding final remarks from Courtney Howard before we go into our Q&A. So with that, it is my pleasure to turn the proceedings over to Dr. Ian Hamilton, Professor of Energy, Environment, and Health at UCL Energy Institute, and Executive Director of the Lancet Countdown on Health and Climate Change. Dr. Hamilton, the floor is yours.
Thank you very much, Ian, and thank you everyone for joining us today. And I'm very pleased to be able to present to you in a short few minutes what has been a year's worth of work from so many authors coming from across this collaboration. So I'm going to share a screen, and that way we can go through some of the findings together. And as Ian noted, if 30 years ago we were saying that we'd come too late, we hope not, but unfortunately we're now at code red, and that's where we sit today in this report and the framing around this, very much to focus on the need to take this action immediately. We don't have time to waste. So this year's report is the fifth iteration of our indicators. So that means we have 6 reports, first one setting out the premise, and then 5 years now of tracking change. It is aimed to coincide in preceding the Conference of the Parties, be able to inform the debate around climate change by presenting health as that personalized angle that we should all be caring about. What it does do is it brings together the scientific consensus. And I think this is one of the most important things that we can be seen to do, is be that evidence base. And we draw from over 90 authors from across the world, 43 academic institutions, UN government bodies, and the like. Each year, what we're trying to do is ensure that our work is supporting the change in the science as well. And by improving our indicators, adding new indicators, making sure that what we present is the strongest that we can. This year, we've also tried to frame the work in a way that is more meaningful to understand the inequalities that are going to be experienced as a result of not only climate change itself, but the ways in which mitigation adaptation has been focused. We have 3 main messages we want to bring forward. First is the health impacts of climate change are worsening across every indicator being tracked, and they are affecting people all over the world. And what's really important for us to understand is that there are vulnerabilities here which are embedded in the systemic elements of our society. That means that there are more vulnerability in certain places, of course, that don't contribute to the problem in the same way. And what we're seeing now is an increase in the risks around, say, heat wave, vulnerabilities due to aging population, groups around vulnerable urbanized populations as well for outbreaks of infectious disease and the like. So this year has been, again, a stark warning around that need to be able to take action, and we're being affected all over. And one of the problems around the action or inaction here, as we've seen through COVID-19, is that response is unequal. What we're seeing that is the same challenges we saw with COVID-19 and the pandemic response is that actions are not going to be protecting or contributing to those who are least able to protect themselves. So what we're seeing here, for example, is that the WHO in one of our indicators shows that only 49% of countries have a national health and climate change plan. And in 2020, 27% of green spaces are classified as being less accessible and below average. So the types of issues that we see going forward are really important for us to get increased action on, particularly for those who are least capable of being affected worst. So the other thing that we look at is around COVID-19 plans as a message area, that we really need to see those as the opportunity to reset, shift direction, and ensure that the investment that's going to be and continues to be undertaken as a result of that economic and health pandemic and the experience that we've seen is to direct those efforts towards building back better in a greener, more sustainable and healthy way. So one of the issues we see is the focus on investment in greenhouse gases and ensuring that what we're doing is decarbonizing as quickly as possible by changing the way in which we're investing and the economic stimulus associated with investments through the pandemic. This just highlights the last few reports that we've produced, which you can freely read and access on the Lancet. If you were to log in and create an account, they're freely accessible. And as I said before, we have many partners from across the world, and we're always incredibly pleased that they take the time and the effort to work with us on these issues. I'm just going to very briefly now touch through a few different indicator areas that we felt of interest to just highlight. There's so many, as I say, 43 indicators. There's a lot of science in the appendix that you can go through in more detail. The first area that we track is climate change impacts, exposures, and vulnerabilities. So I'm just going to highlight a few. The first is vulnerability to extremes of heat. And when we look at this indicator in terms of people who are over the age of 65, and particularly those who would have chronic medical conditions, diabetes, heart disease, lung and kidney disease, they're going to be the worst affected by heat wave exposures. When we look at that through a lens of HDI, what we're showing is there is a certainly high risk among medium and very high and high, and that's to do with the age of the population. But what we're seeing, of course, is that transition in terms of the overall age in other parts of the world, and those who are going to be at a greater exposure to heat, which is concentrating in the equatorial belt. And as migration continues to push more people into different areas, higher exposures, and an aging population on top of that. Another indicator that we track is around wildfires. And I think this is something which as Canadians is ever present, as a summer, again, has been a high heat wave and the risk of wildfires across the country. So nearly 60% of countries have had an increase in the number of days people were exposed to very high and extremely high fire conditions. And that continues to shift. And although regionally these things will change quite a lot from year to year, depending on weather patterns, what we see is that upward trend, continuing to be exposed to very dangerous conditions, hotter, drier in many parts of the world, increasing that risk. Of course, associated with that is not just the risk of wildfire activities, but of course, when they do happen, smoke and pollution in terms of air, affecting those, again, who have chronic respiratory disease. Drought is another area of concern. In 2020, up to 19% of the global land surface was affected by extreme drought in any given month. And that's an incredible problem. Now, again, if you look at this map on the right, it shows extreme drought in 2020. And you can imagine that these are areas where, again, many are already vulnerable to the availability of clean and fresh water and infrastructure to support that. And on top of that, food production is being a major risk going forward. The other thing is in terms of the lethality of extreme weather events. This is a very difficult thing to track. And so this is something which we take a great deal of care working with those who have the best knowledge around this to ensure that we understand that the increase, of course, in exposures of extreme weather events continues to have a steady increase. This is worrying as climate change, one of the main contributors is to basically add more energy into these events, whether that's a hurricane, heat wave, whether that's a winter storm that has more and more precipitation associated with it. Adaptation, planning, and resilience for health, very briefly. This is an area where we're tracking. We're looking at countries and their adaptation plans around health in particular. 52% of countries report having national plans, which is good. We need more. Looking at, as well, the number of health services who have direct meteorological connection points to be able to prepare and pre-plan. So again, looking at, for example, the floods of Germany this year and being able to say, were the healthcare systems available and adaptable to those conditions to ensure that they could treat and provide care at difficult times. Another area is mitigation. When we look at this, the energy system, fossil fuels, to just paint the picture, 73% of all greenhouse gas emissions are directly from fossil fuels. And this is one of the key mitigation actions that need to occur. When we look at this from a perspective of Human Development Index, what we note here is that the very high economies, HDI countries, are continuingly to make progress. The challenge here, of course, is when we look at the high and medium and low. And when you piece these things together as if they were a timeline, the hoped trajectory would take more than 150 years for all of us to achieve the decarbonization required. That's far outside of the 2050 window. Another issue that we look at in terms of mitigation actions is to do with the food we consume. And in particular, noting, again, the enormous contribution that cattle, milk, dairy, and meat has in terms of those emission amounts. And this is total agricultural emissions, which is around 23%, 30% of global emissions. Far more than half of that is due to cattle. And a lot of the excess consumption of red meat poses a health risk. Lastly, just to say, for the health sector, continues to be a major emitter, approximately around 5% of global emissions associated with healthcare services. And this is something which, of course, if we were to meet the SDG goal of health for all, cannot be delivered in the way it is being now. It is far too energy and carbon intense. And this is something which we see as being a major area for people like yourselves being able to take action on, and the policies in the briefs really point towards that. Very briefly, in terms of the economic losses, there is the physical losses in terms of exposures and health outcomes. When that translates into, for example, the events themselves, and looking at this from a lens of economic and risk, is insurance. And as you can see in this figure, one of the main challenges that you see is that blue bar. In the very high income countries, there's a great deal of insured losses associated with these events. So in a way, there's a recovery mechanism. But around the world, that's not at all the case. And as we see more extreme weather events, as I said, with more energy, the impacts are going to be more devastation because of the losses associated with those infrastructure events. Lastly, as well, in terms of coal decarbonization, it's incredibly important that we're able to shift where it is that the economies are directing subsidies, where they're directing funds. I was really pleased over the last number of years, particularly to see the Canadian Medical Association and others who work with them looking at decarbonization as one of the ways in which they're making a difference. Just very lastly is the public and political engagement. This is really where the evidence that we put forward needs to play such a crucial role. We look here around media coverage of health and climate change, and that continues to change over time with the uptake of more stories that can make that connection between these two issues together. And so this indicator looks at the number of media stories where that's being directly associated in major national newspapers around the world. And lastly, for all the indicators that I'll present, looking at government engagement. And this is things where we see change in the debate, change in the statements being made among health ministers and government leaders. There is certainly an increase in the recognition that health as a climate issue, but it's vitally important that that not only gets translated from statements into commitments and into actions. So in the last moment, just to say, we are here at a moment of code red. We need world leaders for COP26, whether that's British leaders, Canadian, Chinese, USA, all have to come together now and make this work. So the health impacts of climate change we see are worsening, and they're affecting those who are most vulnerable all over the world. Just as the world failed to deliver in terms of an equitable response to COVID, we cannot allow that to happen for climate change. And lastly, to see world leaders commit to an urgent action and to ensure that no person is left behind. So we still see an opportunity. There is potential for a better future, and we need actions. Thank you very much for the time.
Thank you so much, Dr. Hamilton, for a very concise overview of this year's report. Certainly encourage everyone to take a look at Lancet Countdown.org for the full report, executive summaries, as well as the policy briefs for all of the different countries who are participating. And Dr. Hamilton has allowed us to share his slides, his presentation with participants after the fact. So we will make sure that you get notified when those are ready. So it is now my pleasure to introduce Dr. Claudel Pétrin-Desrosiers, one of the co-authors of this year's Policy Brief for Canada, to present the Policy Brief for Canada. Claudel.
Thanks, Ian. I just want to take a moment to thank Ian and his team at CPHA for the incredible amount of work as they've done in the last couple of days and weeks to support the launch of the brief. We're very thankful to have you on board. So next, please. I'm going to present briefly the brief that we've written for Canada. I'll do the first part, and then Dr. Finola Hackett, who's the second author, will bring you to the second half of the brief. But I'll just introduce a little bit to the process and some of the main content that we've worked on. and I know in the last couple of months, climate change, I think, really hit us home in Canada. We've seen some health impacts in a more direct way than we've seen in the last couple of years. There was the heat dome in Vancouver, the wildfires in the west, and even in the north of Ontario and Manitoba. We saw even some smog of that in Montreal. There was some floodings in the north. I think it's really the year that health impacts of climate change, of the climate crisis, hit home, and we wanted to highlight that in the brief. Next, please. So just to give you an overview of the 2021 National Brief for Canada, it's been a work of the last couple of months. It's a multidisciplinary and collaborative effort. This year, we've worked with two main lead authors. I'm one of them. The second one is Finola, who will present in a couple of minutes, as well as 5 stellar co-authors that were able to bring their unique expertise. Some of them are here with us today, and they'll be available for the Q&A at the end. We're really thankful that they were on board. Deborah, Courtney, Chris, Angela, and we've worked also with Ashley from the CMA. You guys were crucial in bringing this together. Ian mentioned it at the beginning, but this was also made possible because of the support and work of 2 professional organizations that are essential to public health in Canada, which is the Canadian Public Health Association and the CMA, the Canadian Medical Association. Year after years, they're able to bring their expertise and their network to making this brief alive, and we're thankful that they were there. So for those of you who are less familiar with how this usually works, we collaborate with the Lancet. We basically each year we get together and decide on what we think is relevant for Canada in terms of policy recommendation, and we sort of start to think about what's been on the news in the last couple of months, years, what has been some of the core issues that were discussed or where we see gaps, and then we use some of the Lancet data to sort of turn that into concrete policy recommendation and to show that Canada is a country where climate change impacts health in most of the time in a negative way. We've also built our brief on existing literature and recent publications from partners and from academic scholars. And well, this year we came up with 5 key policy recommendations that we'll go over in the next couple of minutes. Next, please. So just to bring a bit of context to this year, as I mentioned a few minutes ago, I think it's really the year that health impacts of the climate crisis hit home. We've seen climate change in a way that we hadn't in the last couple of years. I think the heat dome in Vancouver was a really strong image and a reality that I don't think we were ready for. That's most likely going to become more likely in the next couple of years. There were that were reported. This is most likely an underestimation, and the number of heat-related deaths from that heat dome most likely will go up in the next couple of months as we do the analysis from a public health perspective. We had a new Canadian heat record of 49.6 Celsius in Lytton in BC, and the town literally went in flames a few days later. We've also noted that there were disproportionate wildfire impacts that are faced by Indigenous people, and Indigenous people living in reserves have a 33 likely chance to be affected by wildfires, and Indigenous people living off reserve. And sadly, what we've seen in the last couple of months is not an isolated event. It's a trend. It's part of a trend in which the impacts of climate change are increasing. Last year in the Canadian brief, we've highlighted that the mortality, heat-related mortality for the population over 65 years old was increasing at a rate that was higher than in the rest of the world. And that's compared to the 2004 baseline. Simultaneously, in the last couple of weeks, we've been gifted with some important report, one from the IPCC, a 6th report that basically said that every fraction of a degree of warming avoided provide critical protection, but they're also telling us that we're on a path to reach 1.5 degrees in the next couple of years, which might be earlier than anticipated originally. And on September 6th, there were a joint editorial in over 200 medical journals that called for more action on climate change and stated that the greatest threat to public health is the continued failures of world leaders to keep the global temperature rise below 1.5 and to restore nature. So based on that, we've tried to provide key principle recommendation that will allow us to sort of transform this threat into an opportunity for health of people. Next, please. One of the discussion that we had was the importance of adaptation. We've often talked about the importance of reducing our emission, but we felt that adaptation was often left out of discussion. So that's one of the reasons that, as you will see in the brief, adaptation is one key sector in which we are asking for action today. And as we write it, this mobilization requires two branches of simultaneous action: adapting to the increasing pressures on our health system and society, as well as reducing greenhouse gas emission to key impact within the range where healthy adaptation is still possible. Next, please. So the first section, and then I'll pass on to Finola. There were two core elements in the adaptation highlights that I want to bring forward today. First of all, is that we've realized in the last couple of years that we tend to silo action. Health people tend to talk with health people, environment people tend to stay within their environmental ministry, and we realize that we need to be silo action to save lives. And so that's why we've realized that all levels of decision makers must coordinate and adequately fund our disaster response and health system adaptation. We know that there's a lack of communication to the public regarding the public health impacts of climate change. And we also know that there's been a lack of funding for health-related climate adaptation project. The Canadian Climate Institute for Choices told us a few weeks ago that less than 3% of all federal climate adaptation funding since 2017 has gone to health-related projects, and this has to change. We've also noted that cities need more resources. From the Lancet data, we drew that 15 of our largest urban centers have identified climate change as a risk to public health, which is a good step. But they also recognize that there are some structural barriers that exacerbate inequities, and this is something that we must resolve. We also wanted to highlight that smaller centers and rural and indigenous communities all are differently impacted by climate change, and most of the time have fewer resources to adapt. So even if we talked about climate adaptation in urban centers, it's important that we keep in mind that there's some smaller communities that also have existing needs that must be addressed. So we wanted to make sure that this was kept in the policymakers' mind. Next slides, please. And the second section of this adaptation part was regarding green space. Again, some data from the Lancet shows us that of the Canadian 8 largest cities, only 5 have reached a medium level of green space coverage, which means that 3 has a low level, and because none has achieved a high level. So within our 8 biggest cities, we're still under a suboptimal level of greenness. And this is problematic because pills are probably some of the best pills that exist to protect physical and mental health in the country. But we also wanted to note that there's some inequalities that persist because low greenness is still too often correlated with low income and racialized neighborhoods. And some of the reports for a public health agency in Montreal show that people in low income neighborhoods had twice the risk of dying from a heat wave compared to people in richer neighborhood for the same health risk factor. And so it's a very still relevant question today about the space that we allow, or the green space in our city. We know that there's inequalities that persist, and those are deadly. Next slide, please. So this brings us to our recommendation. Those are the 3 first recommendations that we put forward. The second 2 are concerning mitigation. But I'm just going to read them out loud because I think they're really, well, I might be biased, but I think they're really good, and they focus on what's really relevant for today. So the first one is to establish and adequately fund, and I think those words are important because it's okay to have a national climate adaptation strategy, but if it stays on the desk and it's not implemented, then we have a problem. So not only establish, but adequately fund a new national body that have the authority to work between silos to develop a national climate adaptation strategy that include risk assessment and adaptation planning. And second, just because we don't see it in as often as we should, but we need to recognize that climate adaptation and mitigation can save money and lives and are good to improve health. And so we want all levels of governments, including the municipal, the provincial, and the federal, to conduct, and the regional level of governments, to conduct and fund and publicize cost-benefit analysis calculation for climate change policies that would include quantification of health impacts. And that must be done in collaboration with health ministries. And finally, regarding green spaces, we want to not only increase, but also preserve green space in urban centers. Most of the time, we still see some pressure to turn those green spaces into industrial projects. And that's happening in Montreal right now. I'm speaking a lot about Montreal, but this is where I'm based from. But we see there's ongoing discussion about turning existing green spaces into industrial project, which could be detrimental to the health of the communities. So it's important for us that we not only increase, but also preserve green space in urban centers in order to reach a high level of greenness, and recognize that we must adapt our strategy to climate change in recognition that trees are also impacted by climate change. Of course, this should be aligned with this new climate adaptation strategy that we are suggesting. So I'll leave the mic now to Finola, and hope you enjoy the rest of the webinar.
Thank you, Claudel. And so I'll be covering the mitigation focus section. I'm a rural family physician based in Alberta, and happy to be helping author the Lancet brief for the second year. So our main message regarding mitigation based on the Lancet data is that we really need to completely rejig the relationship between governments and fossil fuel industry actors in Canada. And I don't think this is necessarily big news for those who are aware of this space, but I think for the general public and general policymakers to be aware of, we cannot reach our commitments under the Paris Agreement and otherwise to reduce emissions without trying to address the root causes and support a healthy energy transition for workers and other communities in Canada. So the interesting data finding from the Lancet for this year is that we are really decarbonizing at a too slow rate. So as you saw in Ian Hamilton's presentation, the average globally is at the current rate of decarbonization about 150 years to fully decarbonize. In Canada, actually, based on our current rate, it's 188, so close to 200 years, so even slower than the global average. We don't have 200 years or 150 or 100 in order to prevent the health outcomes that are worrisome. And so we can't wait. We need to accelerate how we're decarbonizing. In fact, since signing the Paris Agreement, Canada's emissions have grown at the quickest rate out of G7 nations. And so we're making commitments, but we need to actually find ways to achieve them. One of the big barriers is that there are high levels of government supports to polluting industries. And there's many reasons for that, but we cannot achieve our goals in mitigation without addressing this. So I'll get into more of the Lancet data, but overall it's about 2 billion direct subsidies a year, and then well over 10 billion a year if you include other indirect supports to these industries. And actually, since the onset of the COVID pandemic, there's data that show that the rates of these supports actually increased in that year since spring 2020 to spring 2021. Next slide. So here's just a very simple graph to try and conceptualize the data that we're presenting in the brief. So the Lancet calculated the total revenue from carbon pricing, so carbon taxes, et cetera, that have been implemented across Canada in the last several years. So this is data for a couple of years ago, for 2018. The total revenue was just under $4 billion US in Canada. The Lancet also had an estimate for the direct subsidies, which is just under $2 billion a year, as I mentioned. And so when you subtract that, our net revenue is still positive. So it's 1.7 billion if you subtract the net, the direct subsidies. However, the Institute for Sustainable Development has put out reports including public financing to crown corporations, and indirect supports to the fossil fuel industry, which amount to about 14 billion. So net revenue then being negative. So what does that mean? A positive net revenue means that, you know, it's still carbon pricing is still effective because it still costs money to pollute. Negative net revenue means that it actually pays to pollute. As Ian mentioned in the global report, there's only a small minority of countries globally that have a positive net revenue, and according to the basic data, Canada is one of them. So that could be perceived as a good sign. But as you can see, even with just the direct subsidies accounted for, we do have a significant discount on pollution, and the question of whether that should be there. And then if we do account for the indirect subsidies, then we're still in the negative net revenue territory. Next slide. So this is taken from the IISD scorecard that was released last year, and it shows that number in terms of the average total supports. So you can kind of see it broken down under that top pink oval there, where it's about 2 billion. Again, the estimates can vary a little bit because this is not directly from the Lancet, but it's close to the same range of estimates they had for direct subsidies, the 2.3 billion. And then public financing. So that's things like energy-based crown corporations and other indirect supports. And then if you look, I wanted to highlight the bottom right here because how are we doing? I mentioned that with the COVID pandemic, supports have increased. And yeah, we do see that. So 2017 to 2019, total government supports for fossil fuels have increased in the last 5 to 10 years. And so we're not making progress in ending these. Next slide. So we need to reflect the true cost of pollution, and doing this will give us the incentives to improve air quality, improve health, and prevent some of the other downstream impacts of climate change. How can we do this? One of the interesting findings in the report is that we, and Angela Carter, one of our co-authors, was a big help. She's done a lot of research on lobbying and subsidies. And so there's a report with her colleagues that showed that on average in the last year, fossil fuel industry representatives are meeting at least 4 times for every 1 meeting with environmental groups, with federal government representatives. So there's a huge imbalance. It's in the range of about 1,200 and some meetings per year for those groups versus about 300. And so that's like 3-4 times per day compared to less than once a day for other groups. We cite a positive example. So the food guide that came out a couple of years ago was an example of where industry influence was consciously minimized in favor of evidence. And so there were no closed door meetings, and that created a very health-focused, evidence-based policy. And so it's certainly possible. It takes commitment, but we are advocating that that will give us the ability to create policy that is based on the evidence that will promote health and avert the health effects of climate change. Next slide. So this is just a summary of the recommendations for the mitigation section. We know that to protect health, we need to stay below 1.5 degrees, but we're not on track to achieve that. And so a first step to get us on track is to address the relationship with subsidies and lobbying. And it's not just, let's not do this, is what should we be doing instead? We should be supporting a healthy energy transition, support workers in retraining, transitioning, support communities in adapting and integrating industries that are less polluting and finding other ways to reduce emissions, as well as supporting adaptation programs, as was already mentioned by Claudel. And so we have things that we need to invest in that will pay off better long-term in terms of health, and of course, avoiding health costs to the health system. So it's not just about saving lives, it will actually save money as per recommendation number 2. And then of course, addressing the imbalance in lobbying. So that's it for my section. I'll pass it on for the next slide to Deb.
You're
I have to do the Zoom thing. Like, how long have I been teaching and I still forget to unmute myself? So apologies for that, spazzing out. Ian, can we move to the next slide? Or yes. So as I was thinking about this report and the implications that it could have in terms of Canadian climate public policy and the federal government's healthy environment, healthy economy, advanced climate change strategy, where they do mention the development of national adaptation strategy, is some considerations that come out in my mind based on the findings of this report is really trying to look at that from an equity justice lens. That sometimes some solutions could actually be problematic for people who are very disadvantaged, where in a lot of cases basic human rights aren't being met. So there needs to be a very explicit focus on equity and justice lens, and others talked about that. This is what the findings keep revealing. It's just there really hasn't been the kind of action that needs to take place to address that. Some of the challenges are structural and systemic. So in a First Nation context, that's a lot of outdated legislation. You're dealing with historical colonization and ongoing colonization. Ian talked about this in his opening remarks with the reconciliation requires ongoing kind of relationship. So there's people who experience structural and systemic inequalities. And when I think about a policy like this, how are you going to deal with this? It's like you're not starting from the first meeting. You have to address some other issues and considerations as well. The other is knowledge gaps. There isn't knowledge. Lancet does a great job, and we've seen fantastic presentations on all the data, but there's also sometimes there's data lacking because we haven't asked the question, or we're trying to find out the answers, and it could take a few years to get it. So on occasion, we've noticed that there are knowledge gaps that we need to understand a little bit better, particularly in addressing equity and justice lens. My final point, and others mentioned this as well, and we talked a lot about this when we were preparing this report, is a need for engagement in developing any kind of policy, particularly by people who are the most vulnerable, because again, this is recognized from international to the local, but how can they be engaged in these processes? How can community organizations be engaged in greening of a city? So it's not just, let's say, talking to experts, which is really important, but you need to mobilize that kind of knowledge to people who are more vulnerable and suffering, but also make sure that you're getting their voice. So whatever policy intervention happens is actually addressing their lived experience. So those are things that come to mind that I really hope in this policy and developing a climate, actually don't call it a climate policy, an national adaptation strategy, that this gets taken into consideration. And unfortunately, as others have mentioned, there isn't a corresponding agency to support its work. So that's a major gap in terms of developing a strategy and interventions, but actually not having coordinating and de-siloing that others have mentioned in this brief. And I will finish there. Chimigwech.
Thank you, Deborah. And I'll now turn the floor over to Courtney, who has turned her video off momentarily. So hopefully, there she is.
Hi, thanks everybody. I really want to congratulate everybody involved in this brief for some really timely and hard-hitting recommendations. I think for a long time in Canada, we have been really focusing on the health co-benefits. It's really easy to talk about, saving lives through decreasing air pollution, through improved diet, through healthier lifestyles. We enjoy doing that work. We like to see our communities get better. But as we've seen from our actual performance in terms of decreasing greenhouse gas emissions, we're not going to get the job done for ourselves, for our kids, for the planet, unless we have some of these difficult conversations. And we know as doctors that it's always very, very tempting to avoid difficult conversations. I always find myself, having an extra snack or going to the bathroom before I go into that patient room where I know I'm going to have to relay bad news that may lead to conflict. But it needs doing, because the diagnosis needs to be made clearly so we can come up with a treatment that will actually do the work. And so I think what we've done this year, probably prodded by the huge increase in acuity in terms of the wildfires, the deaths from the heat dome. I drove across BC in August, and essentially it was smoke from the Okanagan all the way to Jasper. And I knew that my colleagues hadn't been briefed on wildfires or on how to coordinate with their communities in order to create clean air shelters. We're not ready from an adaptation standpoint. We can already see that we're very much in it, and we're in disaster response territory in terms of the management of these, which makes it very, very clear that we can't afford to have this get any worse. And so I'm really, really proud of the authorship team of the Lancet Countdown for generating the data around fossil fuel subsidies and carbon pricing, and of the Canadian Medical Association and the Canadian Public Health Association for having the courage to sit down, look each other in the eye, look policymakers in the eye, and say, we need to change the relationship that we have with the fossil fuel industry. We need to take a sort of best practice tip from Dr. Jane Philpott, who was the Minister of Health when we created the National Food Guide, which the Canadian Public Health Association and the CMA were both very involved in as well. We've got a world-leading food guide. I present in many different countries and everybody's jealous of our food guide. The product is the result of the process. So we have a map of how to do this well, and now it's time for us to sit down and do it. So I want to say thank you to our two young lead authors, Finola and Claudel. Both put this together in the summer as they transitioned into their very first year of practice, did it on a volunteer basis. And so to me, that's a huge commitment from the incoming health professionals of Canada to the practice and the patients that they're going to care for the rest of their lives. You know, I'm sitting here in Yellowknot's Dene territory in a place that's 2.5 degrees Celsius warmer than it was when an 80-year-old elder was born. And I do want to highlight, as Deborah said, that we have huge data gaps. The study we did into wildfires up here was one of the only real concrete data points they had in terms of wildfires in all of Northern Canada. So if you're a researcher, please consider partnering with Indigenous communities to generate that data, because really we know that healthy adaptation depends on knowing what the problems are and knowing what the solutions are. So huge thank you to everybody. I'm looking forward to the questions.
Thank you so much, Courtney. That was great. And my apologies again to Dr. Smart at the Canadian Medical Association for the technical difficulty, which I have not been able to resolve. But in shorthand, she mentioned that CMA is committed to the issue of climate action, that the member physicians of that association see the effects in their patients in their offices every day, and are they were very pleased to be part of this year's policy brief once again. So we do have a couple of questions that have come into the Q&A, and I'll just point out that we have another one of the brief authors standing by. Christopher Busy has been answering some of those questions, but perhaps Chris, I'll turn it over to you, and you could speak to Emily Fauvel's first question, where she writes, urban islands are linked to social inequalities and inequities. There have been excellent studies completed in the United States looking at this. Are you aware of any research in Canada looking at mitigation and adaptation measures to health urban islands in major cities in Canada? Chris.
Yeah, thanks, Ian. And it's a great question, Emily. There is some fledgling work that's happening in Canada. There's a couple of links that we've cited and made a reference to in the report that I think would be of interest. I think the other report that's really interesting was following the 2018 heat wave in Montreal, and the Department of Public Health for the city of Montreal put out almost a post-mortem where we're drawing from some of that data in this report as well, kind of making the case around what we know about heat exposure and mortality in the Canadian context. So it's certainly a growing area of evidence. And one of the reasons why we focused on green space is not only the fact that it redresses some of the issues that we're seeing with exposure to extreme heat, but there's multiple co-benefits to urban greening. It increases permeable surfaces, it reduces flood risk, it provides opportunities to recreate, it cleans our air. So really, you know, the forward-looking aspect of a greening strategy, and whenever we're thinking about adapting and mitigating to climate change, thinking about co-benefits, thinking about meeting multiple goals needs to be at the heart of our approach.
Great, thank you, Chris. And then another participant had, I'll paraphrase it, it's like using the best evidence available, what policy would cut the most greenhouse gas emissions? Now, Chris chimed in and said, basically anything that contributes is a good thing to consider, but certainly phasing out coal burning power plants can lead to enormous reductions. I thought I'd turn perhaps to Ian Hamilton for the international perspective and see if you had something to add to that response, Ian.
Yeah, I think that's absolutely one of the most important to begin tackling. The fossil fuel use in the energy sector is a major issue. Alongside, I mean, globally, in terms of the use of coal, that's where the a counter effect of air pollution is coming forward. One of the most straightforward ways is to try and switch those to a lower carbon fuel in the meantime, while they transition towards renewable, and recognizing that. The reality is it is a transition. This is not about switching something off overnight and being left with nothing. I mean, one of the energy insecurity issues that are being felt right now are partly to do with, say, supply chain issues, but we have to avoid, I mean, there's no need for us to experience a crisis as we switch these things through ensuring that there's better access to clean energy. And that's really important. To add outside of the power sector is actual buildings, say, use or we use in our vehicles fossil fuels as well, and the direct contributions that those have. So again, on one hand, being able to switch fleets, being able to remove out, say, personal vehicle use that is based on fossil fuel as much as possible in the coming years, to the point where then it's completely removed. And also recognizing that home heating is a major source of emissions locally. When you go across the world, it's one of the big issues that need to be addressed through, for example, again, on one hand, electrification, and that's where technologies like heat pumps and the like. But what I also want to emphasize is that is fine for economies, for households, for businesses who can afford all of those. And that's where we need to also ensure that we're meeting a great unmet demand. Globally, for example, we talked about heat. Well, in many countries, they don't have access to the equivalent of heating, i.e. cooling. So we need to be able to ensure that at the same time as we're mitigating, we're also ensuring that there's an adaptive component being offered. Otherwise, we're at risk of heightening or exacerbating a heat exposure in the future. And that means building better buildings. That means decarbonizing the supply of cooling as well when it's needed and necessary. So I think those are the sorts of actions that we can be taking. And globally, it's a complicated picture. And one thing that I want to emphasize is that the pathways are going to be different based on the local political, social context, but the destination is the same. And it's incredibly important that we make that journey most effectively and as quickly as we can.
Thanks so much, Ian. Certainly, I often use the phrase that climate action is like the industrial will result in as much of a societal transformation as the Industrial Revolution, except we're going to have to do it on a much compressed time frame. So those thinking these issues through and having a long-term vision is going to be crucial. So Kathy had a question in the chat, but I think it's been responded to and everybody can see that. So we'll bounce back to the Q&A module, which is the best place to post your question. And Linda has a question that perhaps maybe Finola you want to address, or perhaps anybody can speak up. So Canada has many challenges to decarbonize our health system. What guidance do our presenters have for a national approach to decarbonize our health system and track and report nationally on our progress when, yes, our provinces and territories control their health systems in our wonderful federated model? Who'd like to tackle that one?
I'll start, and then the other authors can jump in. Obviously, it's a challenge. I mean, we see this challenge with COVID, federal versus local coordination of responses. There are some bodies already out there. So there's the Coalition for the exact Canadian Green Healthcare. I'll find the link and post it, or if one of the others can. So there are national bodies that are looking at specifically greening healthcare in Canada, as at least from a nonprofit perspective. But from the actual public sector government perspective, you're right in that federal policies, I mean, the federal purse obviously can be used to support healthy adaptation specific to health systems, as we highlighted in the report that it hasn't yet done so. Only 3% of adaptation funding going to health. So that's one thing is federally supports, right? Resources can go, But in terms of the actual health systems, that has to be done on a local level as well as the provincial level. For example, I know here in Alberta Health Services does have an Office of Sustainability, and they have been working with the Canadian Association of Physicians for the Environment Alberta Committee, of which I'm a part. And so there are some of these initial steps being taken in each health jurisdiction to look at sustainability. And there are, as I say, I believe the Canadian Coalition for Green Healthcare has a report that comes out every year. I did see one earlier this year, so I will link to that in the chat or in the Q&A box as well, so you can see that they do keep track year to year as a nonprofit. Hope that helps answer a little.
Thanks, Finola. And I think Courtney wanted to add in as well.
Sure. I just want to say that we should ask Linda the answer to this question, because Linda knows better than almost anybody else, has done more work than almost anyone else in Canada at greening our healthcare systems. Something we're going to ask for in the lead up to COP, the World Health Organization has organized a health program around COP that's calling for countries to make national commitments to resilient, low carbon healthcare systems. And we're hearing through our networks that some very big players are going to make that commitment. So the CPHA, the Canadian Medical Association, CAPE, Cascades Network that is really leading greening healthcare here in Canada are all going to be putting a fair bit of pressure on our government to make that commitment, because we see we do have a fair number of federal agencies that help to coordinate care with the provinces, and we need some of that national convening and coordination for multiple reasons. Part of this is that decarbonizing healthcare, as you know, is going to require decarbonizing the supply chain. About 50 to 60% of the emissions come from the supply chain. So we need clear international and national signals that tell our suppliers, look, we're not going to buy from you by the year 2040 or what have you, if you don't have a decarbonizing commitment that equals ours. And so that requires long-term signaling. It requires a sectoral effort. And so national coordination is still going to be really important.
Thanks, Courtney. And Chris also mentioned that the 2019 brief is probably going to be of interest because it has some recommendations in this area as well. And
just maybe
yeah, go ahead.
Add briefly, Ian, as well, that just as a reference point for others, we worked with the NHS in developing their NHS greener strategy, and that's the goal for decarbonizing the NHS in England by 2040. And there's a good report and documentation there, and it really sets out the how we did that work with the NHS Sustainable Development Unit, and where Nick Watts, who was the former executive director for the Lancet Countdown, became the chief sustainability officer for the NHS. And I think those are the sorts of things that being able to draw from and learn from others who are making these efforts, like the WHO and others across Canada, really great to see.
That's great. And in the link, there is, they've added the link to greenhealthcare.ca. So there's something you can follow up with that as well. So we just have about a minute left. Leah has a question. There are competing issues with end-of-life pollution for a lot of technologies, such as batteries for cars, that require a lot of energy to make and a lot of energy to safely dispose of. Okay, I guess there isn't quite a question there, but I guess it's how do we balance the tension between some of these new technologies that may not be as quote unquote green as they look on the surface. Anybody want to tackle that one?
Well, I'm happy to say something. I mean, the reality is that by comparison to their current polluting partners, then things like batteries and lithium ion, these are going to be transition technologies for those types. But one of the main points is that they are at present in terms of operation, although not embodied carbon, they are with carbon neutral, carbon reduced. So there's going to, of course, be issues that we need to address. And the reality is, though, they far reduce the CO2 emissions associated with, say, things like vehicles.
Excellent. Thank you for that very concise response that is getting us ended right on time. So once again, I want to thank all of our panelists today. I just acknowledge that Claudel had to leave. She had a family emergency, and that's why she hasn't been able to respond to any of those questions. But she left us in the very capable hands of her co-authors, Finola Hackett, Deborah McGregor, Christopher Busey, Courtney Howard, and of course, Ian Hamilton from the Global Lancet Report. I want to thank all of our participants for their participation today and for your great questions. And just to remind you that the session was recorded and the presentations will be made available on CPHA's YouTube channel, and every registrant will receive an email as soon as they become available. Have a great day. Be safe, be kind to each other, and stay well. Goodbye.